Hello, this is Raul Pineda, biochemist, DFW Secretary General from Mexico City. I want to thank Médicos per la Vida Organizing Committee for this opportunity to share with you what Doctors Federation for the World, in short DFW, has done as an organization in the past, present, and future during the last day, where we have played a relentless, productive, and relevant task force with communities throughout the globe. Founded in 2020 in Piedmont, Italy by Dr. Fanny Casalo, DFW is a nonprofit organization which has been endorsed by numerous health specialists from all over the world. Our aim is to address acute and chronic diseases from a pathophysiological point of view, with a long-term approach in which people from 5 continents participate on a voluntary basis. Our innovative, disruptive, and constructive strength has enabled real-time interdisciplinary communication and work with health specialists with simultaneous translation into 5 languages, such as English, Spanish, Italian, Portuguese, and French. Our vision is to become the leading international organization in the search for safe, accessible, effective, and efficient treatments, as well as preventive intervention, throughout 4 main pillars described afterwards. Our values seek plurality and open equality of ideas and humanity. Our objectives focus on the generation of solutions of long-term value, as well as close collaboration between clinicians, researchers, and general public. Finally, our activities have focused on both the communication of monthly preventive health schemes, as well as interdisciplinary work with authorities and governments. The W Board of Directors, staff, and even interpreters have been integrated by interdisciplinary, intercultural from different countries. It have been our physicians around the globe who are using evidence-based medicine approaches to feedback to governments and society with preventive and curative schemes. Throughout our core values, we continuously seek for actions to prevent health contingencies. We do not blame nor reproach what has happened in the past, and we target for solutions only. We search, as mentioned, for safe, accessible, affordable, effective, and efficient preventive measures in a free-biased, independent way. We focus on doctors, academics, researchers, and other health allies. In addition, we target government authorities, health systems, regulatory offices, social media intellectuals, philanthropists, and civil society. DFW develops 4 strategic areas. On Pillar 1, all health schemes related to medical schools, universities, health services, pharmacies, and pharmaceutical drugs. We call this pillar clinical practical guidelines. On the second pillar, we all use integrative, preventive, and curative approaches that are not related to the first one. On Pillar 3, all practical strategies and actions to prevent vulnerable populations. And last but not least, on the last pillar of public policies in healthcare crisis situations, we target to prevent population for future health contingencies. In this way, we have held 108 lectures with the following profile of speakers, where 53 conferences have been done from the Americas, 33 from Europe, 11 Africa, 15 from Asia, 3 from Oceania. Regarding our influence and level of profile speakers, 53 of our keynote speakers have PhD degree, 37 with masters and specialty, and 21 with bachelor's degree. Each DFW meeting is held every 2 weeks with the president, vice president, general secretary, and one or two keynote speakers in a 2-hour conference that includes a round of live questions and answers translated into 5 languages. These conferences are broadcasted throughout several social media platforms, such as Zoom, Facebook, Instagram, and LinkedIn. Sharing our vision, and values for 5 different countries have become our way of doing things. These 4 pillars have allowed us to share different perspectives and alternatives of possible healthcare solutions. Thanks to the above, in 2022, we managed to integrate our progress in a very successful and unprecedented international summit that took place virtually from November 11 to 15th, 2022. Thanks to your participation, we made possible to integrate the most transcendental academic program in the history of mankind, because it was the largest with 127 keynote speakers, ambitions from 73 countries, integrative from describing 4 pillars, different pillars or areas, and plural, including 5 continents. Measurable throughout social networks as Zoom, Facebook, YouTube, and LinkedIn, and multilingual with 5 languages in simultaneous translations. Here, doctors, nurses, biologists, chemists, biochemists, virologists, epidemiologists, researchers, traditional and integrative doctors, as well as acupuncturists, Reiki specialists, biomedical engineers, investors, economists, lawyers, former secretaries of health, parliamentarians, and politicians share their knowledge on various topics with the sole aim of improving the living conditions and health of the world's populations. Our 4 pillars were developed during 5 days. Our GSHC, in short, described what the Global Summit of Healthcare 2022 attracted professionals from all over the world, where at the end of the day, a debate of ideas and live interaction was developed. It broadcasted with no pauses during the first day, 9 hours and 35 minutes. The second day, 11 hours and 11 minutes. Third day, 10 hours, 38 minutes. The fourth day, 10 hours, 45 minutes. And the last day, 8 hours, 5 minutes. During years 2020 up to 2024, DFW has participated with other associations with like-minded and similar objectives. On 2022, DFW had the opportunity to share a presential conference and booth at the Second World MPV Congress in Iguazu, Brazil. Professional interactions with other health specialists have been invaluable during the last 2 years for our organizations. We congratulate MPV for your efforts and outcomes. In the future, we are increasing our input, expertise, human ethics, and youth-centered. DFW will develop a set of online service to deliver, increase, and reach its goals. Our mission will not stop to attract, engage, develop, and keep health professionals as part of our DFW family. Additionally, we thank to many young students from the National University of Mexico and Science of Humanities College for their never-ending support to our organization for so many years. Finally, DFW is concentrating and strengthening its structure, consolidating its objectives, supporting and receiving support from clinician researchers and academic, sharing our vision and values, as well as joining forces with like-minded medical associations. This is why we invite you to be part of our family and maybe support us with your with our technological structure and interpreters. This is what DFW wants to share with healthcare sister organizations like MPV. At DFW, we are convinced that only by dreaming, working tirelessly, staying focused, and working surrounded by valuable people like yourselves, we will achieve and exceed our goals for a better planet and a better health for people across the world. Thank you, thank you, thank you.